Welcome to the Counterfeit Sleep Podcast, Dr. Fark.
Thanks for inviting me, Tara.
Oh, you are most welcome. I'm really excited to have our conversation today. I think about we really have three things in common, and I'll mention them in increasing order of importance. So the first small thing is we've both spent a lot of time in the Bronx, down in New York City, right?
Mhm.
We also have a very integrative view of what we do, and then the third thing is we're really passionate about that and really strive to help people just have better lives. So, would you please uh, put those three things together for us? The Bronx angle, the integrative view, and the passion that we both have for for helping people.
Sure. So I was actually in private practice in Manhattan for about 13 years before I came to the Bronx. I moved to Montefiore in academic medicine and surgery. But my passion has always been helping people breathe better, sleep better, and live better. And this came about when I was an ENT surgeon back in Manhattan. I realized that many of these symptoms that people came to see me for, whether it's sinus problems, headaches, fatigue, ear pain, throat conditions, they all had in common a breathing problem. And so when I started addressing these breathing issues, the symptoms and the conditions got much better.
So, how
So
did
that's
you
when I started to yeah.
Yeah, sorry. So tell us a little more about that when you said, you realize that this wide range of conditions, really, right? All
Mhm.
the things you mentioned, sinus
Mhm.
problems, throat problems, I forget even the other things that you said.
Yeah.
All of those diverse sort of things within your
Mhm.
ENT world really had one cause. So how did you come to really, figure that out?
Well, a number of different factors, but basically, I came across a number of different dentists back then. Dr. Brian Palmer was probably one of the earliest ones I came across. He was passionate about how breastfeeding is so important for proper development of the infant's face. And then I came across some studies of, let's say, for example, anthropologists like Dr. Corricini, who found that cultures that ate harder foods had better teeth.
Mm.
And then I also started helping people surgically to breathe better. And once in a while, you have these dramatically impressive results, not just to breathe better through the nose, but their mood, their headaches went away, everything improved. And then I started to just connect all the dots and realize that most modern humans have a problem breathing while they're sleeping, and that's why they're not sleeping well.
Wow. So yeah, it's interesting. I think as you first mentioned the breastfeeding, right? We've had a lot of evolution in that in general, especially in this country, where it was almost taboo for a while, and then it has come back, more.
Mhm.
But I'm still not sure it's the mainstream. But
Mhm.
absolutely, that impacts things. And tell us, when you mention the development of the jaw, the chewing
Mhm.
and hard foods to help the jaw and the teeth develop. We actually had in an earlier interview on the podcast a guest, Christine McManus, who
Mhm.
mentioned that she actually went to you for treatment for her challenges, and she said you said something to her when she walked into the office. Do you happen to remember what that was?
I vaguely do remember her. It's been a while since I've seen her, but I do remember that she had a very small mouth. And I
Mm-hmm.
can just tell from the moment the patients walk in the door, just looking at their facial features, if they have these more narrow jaws and more recessed faces, I know what kind of problems they're going to have just
Right.
because of the shape of their facial anatomy.
Right,
And
right. Like
so,
we call like reading the face, kind of. Once you see it,
right,
right, you can't unsee it. Yeah,
right. Yeah. Yeah. One of my hobbies is I do what's called facial profiling. So
yeah. That's
I can
great.
I try to predict people's health outcomes based on their facial appearances, which is, I mean, you can take it any way you want, but it's kind of fun to do that and to basically see that most of the time I'm right.
Yeah, I can definitely relate to that, I'll just give you even a funny example. As a breathing specialist, I'm always looking at the same thing too, the development of the shape, and then of course what the posture of the mouth is, how people are holding their mouths. And we know, and maybe by now our listeners will know as well, that the open mouth is definitely getting you on the track to have trouble
Mhm.
sleeping, right? And so I'm talking about this all the time. And at the time, I guess my daughter was probably around 7 years old. And so unbeknownst to me, she's hearing all of this, and one day she comes home from school, and she's normally a really calm and soft, kind of gentle kind of kid, but she was raving mad. She came in, she threw down her backpack, and I was just like, what's going on here? So she just unloads. It was some boy in the school who did this, and it was her pen and her paper and her chair, and mama, he's a mouth breather. Just had to laugh. Like, wow, she's clearly been listening to all the calls I'm doing here. But yeah, so you're right. And then there's even stronger things because of that, the way the actual face develops, the way the jaw sits relative to the rest of the face. Great. So yeah, so that was a big part of Christine's thing. So tell me, when you do have a patient like that with as Christine had, a really a small jaw, or you have in general, patients who are having this, what are some of the things that you do to help them be able to breathe better, so that they can really it helps get over their counterfeit sleep problem, right? So how do you help people?
Well, by definition, if you have a small mouth, you're also going to have nasal congestion. Just to kind of describe what happens, people with small mouths have high arched palates, so the roof of the mouth is arched up like this rather than being like this. So if the hard palate drops down, then the molars and the teeth widen, so you have broader arches and you have straighter teeth. But most modern humans have crowding because the palate is arched up like this, and the molars are more closer together. Inside the nose, as the septum, the middle of your nose, as it grows down, if the floor of your nose doesn't drop, it's going to buckle to one side like this. So that's why people get deviated septums. Yeah.
Oh, that is fascinating. Wow. So, and since most people will be listening to this on the podcast, we'll just take a second to really put into words what you were just describing there, because it's so important. So when you're talking about the roof of the mouth, kind of almost what we call like being vaulted, like think about like a church spire almost. It's coming up, it's not pointy, but it has, rather than being dome-like, it has more of a sharper angle to it, right? I can't quite off the top of my head think of a comparison, but it's not a nice dome as we want it to be, right? So right from the get-go, you're going to have trouble fitting things in the mouth. But then just repeat what you said then about what that does, how the septum is affected, either if there is the dome shape, which we want, or if there is more of the vaulted high palate, which we don't want. Yeah, let's run through that again.
Sure. The floor of the nose, where the nasal septum is the midline of the nasal cavity like this, and this is the floor of the nose, which is the roof of the mouth here. So if the hard palate doesn't drop during development, the septum, as it grows, it has nowhere to go, so it just buckles to one side.
Interesting.
And so also like the side walls of your nose is more narrow too.
The side walls. Oh yeah. So that's why would that be why you'd have smaller nostrils then too? Because,
exactly. Right. And then the angle of the nostril is more narrow like this rather than like this. And so the combination of different factors that leads to nasal congestion, and you're going to tend to open your mouth more during the daytime, or especially at night when you're sleeping.
Interesting. That's fascinating, and I hope people in the audience are able to get the takeaway from that, because it's I've been in this for 6.5 years now, and I've never heard it explained exactly like that. So that's beautiful. But the takeaway is the way the roof of your mouth is, the way what we call your palate, the way that is shaped is going to determine how well you can breathe through your nose, right? We want to have a really a nice kind of dome-like shape, so that the nose above that, the stuff that's sort of going to be resting on, maybe we can think of it like that, the the dome is really the foundation for the structure of the nose, right? And
Yes.
so if the main part of the nose, the septum that is coming into the dome, if that has enough space to rest there, we're good. But if
Yeah.
it doesn't, because the dome has gotten kind of, you know, crushed and become a much rounder, much higher shape, much more like oval, I guess, if we want to just for a visual. So it's become more like an oval, then the septum is going to be bent and,
Yes.
what we call deviated, and the nostrils and the side walls, as you said, will be much smaller to begin with.
Right.
That's fascinating. And then that's going to impact your breathing. You'll have a harder time moving because it's not it's like a hose. Then all of a sudden, if you put a kink in the hose, a garden hose, the water doesn't flow freely, right? And so if we put a kink in our noses, the air can't flow freely. And job number one, make sure we have air, right? So we have this backup system, this mouth, but it's really it's a lends to a cascade. It leads to a cascade of problems. Wow, so that's really fascinating. Like I said, I haven't heard that explained in that way. Thank you
So,
very
so
much.
going along with the hose analogy, if you add additional irritants inside the hose, such as allergies, where you get swelling of the membranes, that narrows the passageways even further. And lastly, because the outer part of your nose is flimsy, your nostrils are flimsy, as you breathe in, your nostrils cave in more.
Yeah, yeah, and that's actually a test that you can do, right? I mean, it's basically at that point, it's a pressure thing, right? The greater the pressure, the more you'll get collapse, right?
Right.
And so it isn't there like a, and I don't remember the name of it off the top of my head, but the you can ask a person to inhale very quickly, through the nose. And if you get that collapse, if you see them caving in, then you know that your nostrils are, your air, your passageway through the nose is probably compromised in some way and could be impacting your sleep then, right? Yeah, and that's
But
actually, they
yes,
talk about is it the coddle maneuver where you put
the
your
coddle where you
fingers.
just kind of lift your nostril up like this. And
Yes,
now
yes, right.
that that works most of the time, but what I do in the office is I put little Q-tip ends and lift up the nostrils from the inside. That
Ah,
works much better.
uh-huh, uh-huh. And even for like to help people clue in, they could try that coddle maneuver. And I would say if you get the collapse, if you breathe in quickly and you get the collapse and you're like, oh boy, maybe this is a problem, just try and open the nostrils up. And if you notice a big difference, then that's a great sign to say, wow, maybe I should seek out an ENT to see what might be going on and what maybe I should do so I can breathe better, so I can sleep better, right?
Right.
Definitely.
I
So,
actually have a funny story about this where patients occasionally tell me that they have to sleep on their sides because that's their preferred sleep position. But the way they sleep is that they have their face on the pillow like this with the arm against the face, against the cheek to lift up the nostril like this so that they can breathe better.
wow, so like a natural compensation.
Yeah, it's like this. Yeah.
Yeah, and
They don't realize they're doing it.
I have seen people sleep like that with their
Yeah.
arms out. So wow, I
Uh-huh.
never thought about how that would be a compensation, really, a little strategy. Interesting. Great. So tell us then. I know. You tell us a little bit about your book too, where in case people want to really dive into this, and especially because we're on the podcast. We'll also, this will also be the video will also be available so people could see how we're gesturing, because it is sort of a complicated topic, and gestures help it. But if people want to dive in, just tell us about your book and where else people would be able to get more information about what you do.
Sure. My book is called Sleep Interrupted. And I wrote it about 9 years ago when I was in private practice. And it describes my sleep breathing paradigm where I integrate and combine everything together with breathing, sleep, health, digestion, and other conditions like ADHD, depression, pregnancy complications. So I tie in everything together to try to explain why we're so sick and tired.
Yeah.
And it's surprisingly, it's still selling pretty well after 9 years. It's available on Amazon. And my website is drstephenpark.com,
Great.
DOCTOR, stephenpark.com.
Yeah, yeah. And I think I'm not surprised at all to hear that your book is still really selling well because I think, especially now, people are really looking for more than the band aid approach that they
Mhm.
typically can get from, a doctor who is more traditional in their training, right? A lot of people are really looking for is a much more integrative approach that's going to help them just have a better life, to get back to feeling great again, And so I know your book does that because I've read it. It really does pull in all those important things. And I want to ask you about one last thing before we kind of finish up. I know we spoke first back in, I think it was in 2018, as I started doing research for my book, Is Your Sleep Making You Tired? Which actually is finally going to be coming out in September. So I'm excited about that. You told me a fascinating story, and I would love if you would just sort of talk about it now. But it's what you noticed as a surgeon when you would, and I think this was on your lead up to really, connecting all the dots. You talked about what you would notice in the tissue in some of
Mhm.
your patients. Can you
Mhm.
tell us a little bit about that and what the implication was of that? Because that blew my mind.
Yeah. So I noticed that I noticed this more in general surgery when you're looking at the bowels when you're doing abdominal surgery, that healthy young people, let's say for an appendectomy, for example, when you go in the abdomen, the tissues are very pink and moving around, what's called peristalsis. They writhe, very active, and just it looks very healthy. But in older, sicker people, it's dark, dusky, there's no blood flow. And so this kind of goes along with an anecdote that I heard about from the Civil War, where it was written about where there was a soldier that had an abdominal blast wound, and the abdominal wound was just torn off, and you could see the bowels just right there. And as they were doing tests and doing procedures that were painful, you saw that the bowels became more dark and dusky. Whereas when he was happy and laughing and just in a good mood, it was nice and pink and healthy looking. So your level of stress significantly affects how much blood flow you get in your bowels and other important organs in your body. So that's why good sleep, stress reduction, eliminating toxins, these are also important concepts that contribute to optimal health and wellness.
That's a, it just, it's,
Mhm.
like I said, when I first heard that, when you shared that with me a couple of years ago, it was, knocked my socks off. And even now it's still, is just so powerful, especially as we think about what we're living through now and all the uncertainty and stress
Mhm.
that people have. And
Mhm.
really, it is the one thing that we really can't afford to have because it is in direct contrast to what we need, right? We can't afford to be impacting the functioning of our system because of our stress, especially since you're talking about the bowels and like, I guess, the gut and all. We talk about how much of the gut we now know is actually contains, I mean, how much of the immune system is actually in the
Mhm.
in,
Yeah, yeah.
in the
Mhm.
gut, right? So if we're putting
Sure.
all this um, you know, dysfunction, really, it's basically
Mhm.
dysfunction of that system, then we are
Mhm.
really impacting our overall health. So it's really, you know, it's really something we need to keep in mind and do all things that we can for stress reduction. Of course, I think we both
Mhm.
agree that getting good sleep would be at the top of
Mhm.
that list. Breathe as best as you
Yes.
can, right?
Yeah.
Optimize your breathing, optimize
Mhm.
your health, and then, optimize your what your I talk about it as the core four, right? Our number one
Mhm.
need is breathing, our second need is sleep, our third
Mhm.
need is hydration, and our fourth need is nutrition. And so if we really buckle down and get those four things in place, then we should be good. We should be able to manage whatever comes at us. Wonderful. Well, thank you so much for sharing that because it's just it's literally an insider's view of what's going on. You can just see what's on the inside. Okay, so the last thing I would like to ask you, Dr. Park, is given all the experience you've had, all the time you've had through your career to really think about this, your paradigm, all of that, what message would you like to get out to people? And here's the restriction, really. It has to fit on a billboard. So knowing that billboards are relatively small and people are driving by relatively fast, what would you put on there to help people really appreciate your message?
Don't laugh. My message is shut your mouth.
I know exactly where that comes from. Go ahead and tell us exactly what that means to you.
So in general, you need to keep your mouth closed when you're not talking or eating. And if you look at traditional cultures, even in my culture in Korea, mothers used to tell their kids to keep their mouth closed all the time. They would constantly keep the lips together and do everything possible to keep the mouth closed. And that's why it's so important to breathe through the nose. It's not just for getting air into your lungs, but on another side note, the nose makes a gas called nitric oxide that when you inhale into your lungs, it increases oxygen by 10 to 20% because it dilates blood vessels, and it kills bacteria, fungus, and viruses. It's antimicrobial.
Absolutely.
So not in addition to good sleeping and due to good breathing, it has many positive benefits as well.
Absolutely. Yeah, I completely agree with that. And it's very funny. My father was from Ireland, and a very common expression over there is, shut your mouth. Like I remember him as a kid, and I actually even joked with, of course, Patrick McKeown. He and I were talking one day, and he's from Ireland, right? He lives there now still. And I was telling him how my father used to say to us as kids, shut your mouth. But it really is. We want to make sure we practice exclusive nose breathing. And we get into that in different episodes on the Counterfeit Sleep podcast. So tuck that point away, shut your mouth, right? As Dr. Park is putting on his billboard, tuck that away, and we will revisit that in the different episodes, because it really, exclusive nose breathing is really the key to everything, right from the get-go. So I thank you so much, Dr. Park, for coming on the Counterfeit Sleep podcast with us, and I look forward to. Did you tell me that you have something else coming out in the future?
Well, it's not official yet. I'm working on a big project and a program, but it's not gelled completely. But hopefully, I'll have it coming out in the next couple of months.
All right,
make a big announcement.
We will keep an eye on that, and do let us know when you have that out so we can share it with everybody, because I know, as I mentioned in the beginning, everything you do really comes from that fully integrative philosophy, and that's really what we need to be doing, to really keep ourselves. We need to look at the whole picture, and that's exactly what you do. So I thank you again, and I look forward to seeing what you come up with next.
Thanks for having me here. I really enjoyed this.
Thank you.